whereas I think there were a lot of chronic pain patients that we lost at treatment 2 or treatment 3 because it wasn't making any difference. Now we've tied in this approach, we certainly have people who come back and pursue a slightly longer journey, and they're then getting results. Whereas, when we were just treating them sort of just osteopathically, I think we lost them because essentially it wasn't enough of a difference, and they perhaps tried lots of other people first. Certainly now we have people who feel so empowered in their own health that they're actually making, they commit to a longer journey, and then they're getting better outcomes.
Yeah, I can't speak for the other professions, but I think one of the potential problems with what we do as osteopaths is that we're kind of schooled. If you haven't fixed it in 3 sessions, then you've got to push people on. And we're resistant to that whole idea of maintenance treatments, if we want to call it that for this purpose, where we're seeing people over a regular basis. And I was actually talking to somebody on the course we ran this weekend about Russ Rosen. One of the students on the Laurie Hartman course was saying he follows Russ Rosen. He's a chiropractor who's been on the show before. And he's just got this fantastic approach to, the critics would say getting people into the clinic, but actually Russ says it's not about that. It's about what does the patient want to achieve. And if you give the patient the idea that, here's a goal that we're going towards and you're getting closer, then they can make that decision to go on. And I wonder if that's, sorry, I'm talking a lot here. I wonder if that's quite an important aspect of SIRPA, in that, people have got to accept that it isn't a slow process. It's not an immediate process, sorry.
I completely agree with you. And in fact, the other question that we've added, along with what are you worried that it is what do you want, how do you want to feel, or what do you want to achieve? And that then, like you say, then we've got an idea. If they go, well, I want to be better by next week, then, well, we might not be the people for you. But actually people, I think when you've sort of talked about it and explained it, and I think so often they've been not heard by other health professionals.
Yeah.
And so actually when they come in and they are heard, and you go, oh, do you, as I say, we've added questions, things like, do you suffer with anxiety? How's your sleep? Have you got any sort of major stressors at the moment? Have you had any major stresses in the past? Suddenly they're like, oh, hang on a minute. We're now being heard. We now know that there's a pathway that we can go on. So I do think that they stay for longer. And interesting enough, that's partly, I didn't finish telling you about my case, but sorry. She's, we're 10, no, don't worry about it. We're 10 treatments in, but she's got the tools, she's got the technique. She now can see, actually, if I have a bad half an hour, it's a bad half an hour, not a bad week. And I think it's about learning how to sort of deal in this overstimulating modern world, partly as well, and I think, people feel, I don't know, they feel supported on that journey.